Transition Senior Living Seminar Series. This is our 104th installment, and I'm your host, Beth Ledulo. Yes, hard to believe 104, but we're really excited about that. You know that Great Transitions is a system for working with seniors and their families as their lifestyle and housing needs change. We're here to help you put together that plan, right? Sometimes it can be 12 to 18 months, 3 to 5 years, or maybe just a few weeks before a change is made. And we're here to support you with that and through that process. An event can cause things to move really quickly. And if you don't have a plan in place, sometimes you have to make decisions without having the best available information. So our goal with these seminar series is to provide you with information so you can craft that plan that's going to work specifically for you, so that when you need to implement the plan, you simply pull it off the shelf and you know exactly where to go with it. We and our educational partners are here to guide you through the entire process. We genuinely believe that providing this help and guidance to seniors is our highest calling, and that's why we're all here today. Our objective here is to provide you with education. We say it every time we meet. We're not here to sell you anything, but we want you to have the tools that you need to make the decisions that are best for you. We always make this challenge, and it's fun when I get to hear you telling someone else this challenge. Do you know what your plan is? Have you communicated your plan with your all-star team? That could be your family, your friends, your trusted advisors, and will you agree with the decisions that they make on your behalf? With that said, we're going to jump into our topic today. We're going to be tackling the differences between home care and home health. And we throw these terms around a lot, and sometimes we mean the same thing. So we're going to explore that a little bit when we talk to our panelists in just a few minutes. Whether you choose to stay in your home for the length of your days, you might move to a 55-plus community. You might move to a senior living community like the ones you heard from just a few minutes ago. Wherever you are residing, the chances are pretty good that you may have a time that you're going to need some assistance. And that's what we're going to break down a little bit today. We heard an interesting statistic recently, and there's been a lot of talk about this, but the way it was presented to me caused me to stop a little bit. In 4 short years, 2030, there will be more people over the age of 65 than there are under the age of 18 for the first time in history in our country. So that's a big population that is going to need to be served. And we will talk anyway about some of the people that will be doing the serving as we get going here. We're going to hear some real stories. And because I think those illustrations help us to say, oh, that's similar to what I'm facing, or maybe I've never had to face that, but it's something that I need to think about. So with that said, I'd like to jump into our topic. I'm going to have our panelists introduce themselves. And Melanie, we've already met you this morning, but maybe you can tell us just a little bit more since we're on Facebook Live right now.
Okay, so I'm Melanie Lee. I'm still Melanie Lee. And my husband and I own Flourish in Place Home Care Solutions. And we are part of the puzzle for the future for a lot of people who would like to stay in their homes, even though they need care with activities of daily living, or which we can explain that a little bit more later. But that's what we do. Awesome. And we work really well with this one.
That's why I think this is going to be a great discussion. Paige, tell us about yourself.
Hi everyone, my name is Paige. I am a registered nurse by trade, and I'm actually the director of a home health company called Elevate. So similar to what Melanie does, we help our patients stay in the home and take care of their medical treatments. She said we'll go into that more later, but we are one of the people who want to help you thrive where you want to be, in the home rather than in the hospital.
Awesome. Well, thank you both for being here today. We're gonna kick off with maybe some definitions. Let's talk about the differences between home health and home care services. So Melanie, talk to us about home care.
Okay, I sure will. And this is a topic that most people who aren't in the business get wrong, because they sound alike. Our licenses sound alike also. But home care is personal care. It's bathing people. It's helping them get dressed for the day. It's changing their depends if that's what needs to be done. It's all of those types of care that someone may need help with, even if it's just you need someone to stand by while you take your own shower because you're worried about falling. So home care is all of that. We also, and when I say we, it's any home care agency. And I can talk, you've got this on the back of your forms.
It's on the screen right now.
Okay. But there is a difference in types of home care companies. And we are a W-2 agency. So when I say we, it's anybody who is a W-2 agency can do these things. We can take people in their own cars or in the home, the caregivers' cars to their doctor's appointments, to pick up their medications, take them to the movies or out to lunch if that's what they would like to do. There are a lot, but mostly personal care.
Okay, love that. And I know when I had my foot surgery and I had to get in the shower the first couple of times, I live alone and like that would have been nice to have somebody there just in case, right? Yeah, exactly. Paige, talk to us about home health.
So home health on the other side of the spectrum, we come in and provide you with needs like your foot surgery. So in that event, if you don't have somebody to assist with doing the wounds care, if you have to come home on IV administration, our team would come in, we would perform the IV administration for you, we do the dressing changes for you, rather than you having to attempt to leave the home and try to get to a doctor's office. Sometimes leaving the home can put you at risk for infection, and our team comes in and we take care of you, make sure that you have that decrease in infection. So we're more of the skilled side where we take care of any medical procedure that you would typically have done in a hospital or in a skilled nursing facility. We can do that bedside in the comfort of your own home.
Okay, that's great. So let's talk about the home, since that's mostly where you're visiting, whether it's a community or a house, right? What are some things we need to be aware of in our home that may pose a challenge as we age?
So one thing that I get most often that some people would think is silly are your throw rugs. Some of your carpets, it is very easy to snag and trip and fall, which can lead to an injury. So those are one of the most things that we look for are changes in your home that might occur. So that's one of them. Some other changes could be how you walk around in your home, adjustments to light, and making sure that you're aware of where the objects are in your home to prevent future, harm.
Really? Do you have anything to add?
I do. I think it's this is not to sound demeaning at all, but it's almost like looking through when you've got a young toddler. And you're like, what's gonna be a problem if a fall happens? Like the sharp corners. Depending if the person has dementia, that's a whole different look at the house. Then you want to look at the oven and the stove. You might want to consider turning some of those things off But then again, caregivers can come in and cook. So it's a give and take. One thing that nobody likes to hear is maybe rehoming large dogs.
Large dogs? Why?
Because they tend to make people fall. We had a lady one time, the dog dragged her out of the car. You know, the dog, she was holding the leash, she's in the passenger side, the dog jumps out, she jumps out. And she has also fallen in the house because the leash got tangled around her feet. So it's not something you want to hear,
No,
but
because their furry family members are oft needed.
yes, they are.
One of the things that we notice a lot as we're preparing homes to go on the market, because most of our clients choose to move out into wherever their next downsized spot is, whether that's a condo or a community. Lighting. I am floored by how many times we see the ceiling fan lights and there's only one bulb. The bathroom lights, there's only 2 out of the 4. These houses are dark. And that's, well, I like light, so it's depressing, I think. But, you know, it's like, well, I'm saving energy because I'm not using as many lights and I'm keeping my blinds drawn and all that. But it's not worth it if you can't see where you're going.
And you might not see that puddle on the floor.
Oh, yeah.
You know, there
Where the ice cube fell and
Right.
Yeah,
Right.
yeah, exactly. So change your light bulbs.
Right, call and see what you have last month to help.
Yes, call the people from Lasmo. They'll help you with that. Oh. So in my home, if it's recommended that I need some grab bars or bed rails, is that something that home health or home care would help with, Melanie?
We would not be installing anything.
Okay.
But we have people we work with
Gotcha.
who could come in.
Would you be the ones that say, oh, you might want to?
Yes, we have a whole checklist, a safety home checklist that when we go do an assessment in someone's home, we go through that list and talk to them and, you know, tell them the hard stuff and the easy fixes.
Okay, that's great. Paige, what about from a medical standpoint?
From a home health perspective, it's very similar to what Melanie said. We also can make recommendations. Our physical and occupational therapists come into the home and work with you. If they see that it might be a need that you have, they do make the recommendation. We also do not install them. However, when they are installed, our team will actually come out and train you on safe, we call it transfers. But there are safe ways to move to be able to grab the grab bars or the bed rail in a certain way to prevent fall or injury.
So, just so we're clear, maybe in a session where one of your physical therapists is coming out, you've got the grab bars installed in the shower, that session may be spent simply getting in and out of the shower?
Correct. So they would assist you. You don't actually have to be bathing. It would just be a session where they're training you how to do it. They do more so for occupational therapy since you're using the upper part of your body. They will teach you how to reach for it without putting your head down to cause dizziness. So they really teach you good body techniques to make sure that you can transition safely so you can build independence in your home.
I love that. Because I think when we make those, a lot of people are scared to make those changes because the muscle memory is not there. They're used to not having to use bars by the toilet or in the shower or even getting in and out of the step down in the garage or walking down the ramp.
So one thing I would add to that is that if they have home health there, so like elevates in the house, and they have home care, we send a caregiver while this training is happening so that we know how they're supposed to transfer and use this equipment also.
Okay.
And that helps us because we will stay there longer. We have longer shifts.
Gotcha.
They're there for a short period of time, so we'll be able to stay there and use the same techniques.
So could do some practice follow-up, or let's try this one more time, or whatever.
You know that's not the way you just talked.
Wrong hand, right? Yeah, just remind you. And it's hard when you've been used to doing it one way and having to do it another way. That's a big shift.
It is. Big shift, brain shift.
A couple of years ago, we had on our panel a certified aging in place specialist, a CAP specialist. And she was a physical therapist that had gotten certified to do that. So that's an option too, if one of your companies are saying, hey, we think you would benefit from having some appliances installed in the home in the way of grab bars or maybe a ramp or something like that. A CAP specialist is a good person to come in to take a look, because we want, one of the things I remember we talked about in that session, you can buy suction cup grab bars. Are they useful? Not in your States, right?
I mean, I used to get them when I would take my sister, like we took my sister to our son's wedding.
Mm-hmm.
And I know we were gonna be staying in a place that wasn't handicap equipped. So the little shower seats are not expensive. And then I just got a couple of the grab bars. It sounded like she was gonna be doing it by herself, but
Right.
it would help her while I'm helping her.
Steady her, yeah. So maybe for in a pinch, I love that, going on vacation somewhere, stick in your suitcase. But yeah, you wanna make sure that those items are gonna support your weight and pressure and all of that stuff. Awesome. So Melanie, let's talk about the little, and then Paige, the roles that home health services, medical, non-medical play in allowing me to stay in my home or maybe in a community in independent living as long as possible.
And that's so important. If you live in a community that's a continuing care community, a lot of times it's in your mind, you don't want to go down to the next level below or the next level below. So at some point you may need help staying in that independent status, or may even need help staying in the assisted living status.
Mm-hmm.
And we can come in and help with that by, we've done this several times at different places, but one lady who was also a nurse, she wasn't very social. She didn't enjoy going down to eat with everybody. And so our caregiver would go down and get the cafeteria to put everything in a takeout bin for her and take it upstairs. So we can do that. We can also encourage people to stay connected in activities and things. Like, you may not want to go alone to do that aerobic swimming. I'll go with you. And just generally helping them with their incontinence care, because that can get really embarrassing, especially if you're in a group like that. But at home, we also help with laundry, we help with light cleaning, we help with preparing meals and cooking. And if we're not there over the weekend, a lot of times caregivers pack up dinners and things and put them in the freezer or in the refrigerator for later.
I would think it's very reassuring, because to your point, even if you are in a community where assisted living may be the next option, nobody wants to make that jump usually.
They don't. My mother had to do that at Orlando Lutheran Towers because she had an issue with her medications. And in an older person, a medication issue sometimes looks like dementia. And so we moved her to assisted living because we were going out of town. And all of them said, she'll never be back. She'll never be back. I'm like, you just watch her. They called her Lazarus for a while. But it does take extra support, because those, a lot of times places don't have enough staff to give you the one-on-one care that you need to stay where you are.
Right.
And
Well,
that's,
yeah,
that's
'cause
our
it's independent living.
Exactly.
Yeah.
And that would be, I mean, we're always one-to-one.
Gladys, Brittany, you see regular home care people coming in to help with your independent living residents?
Oh yeah,
Yes.
it's ideal if it can be scheduled. That's what we tell people.
Okay,
So it's nice if you can, if your needs are predictable and can be on a schedule, you can stay in independent living and have the home care. When your needs become more unpredictable, we might encourage you to go to assisted living.
love that. So if you didn't hear her, what she said was when you have predictable needs, it's much easier to stay in independent living for a longer period of time and that can be scheduled. It's when things become unpredictable that the need for a higher level of care might arise. Let's look at that. So that's personal care, medical issues.
Absolutely. I know I forget. How many of you do forget to take your meds in the morning or in the afternoon? It happens to most of us. So our team will come in and challenge you with ways to remember. Writing on the refrigerator, leaving your pillbox planner somewhere where you frequent most often, and it triggers that memory to say, this is what I have to do this morning. So from a home health perspective, part of our role is to come in and make sure that you are taking those meds, that we teach you the importance of when to take them, how to take them to prevent symptoms happening, and to encourage you also on a diet. If you have diabetes, what is the best thing for you to be eating on a day-to-day basis? If you do need medication, we're here to help you. We are that transition between your provider and being at home. And we do work hand in hand. We also do treat inside of independent and assisted living facilities because you are still actively doing care on your own. So part of our role is to make sure that you are staying compliant with what your provider has written for you, but really being that support. Another factor that we have that we can transition with is our clinical staff can actually teach home care how to set up your pill planner as well. So when we are no longer in the home, they also know how to continue to set that up for you so you can continue on being independent when we're no longer there.
And I have to correct you on that. We don't have a license to allow us to set up planners.
You can watch them set it up.
Yes, and we can tell them which to do. It's a very fine line.
Okay.
That we can take the medicines out of their, you tell me when I'm wrong, okay? Out of the pill containers, put it into their hands. And we can get them water and we can help them bring it up to their mouth, but we can't fill the organizers.
Okay.
And like we can clean catheters, but we can't replace them. It's a very fine line, but that's why we work together.
Sure.
Yes.
Well, and I think to know that it's not, oh, I hired home care, I'm set. Or I have home health coming in, I'm good. You really do need, it sounds to me like, both to kind of, or you may need both
Okay.
to work in concert.
At least for a while, if you come out of the hospital. or
Yeah. Okay. We talked about, when we were talking about risks in the home, falling. So if I'm a fall risk, Paige, how can home health help me with my balance?
So our physical therapists and our occupational therapists, they are actually trained to be able to test your balance. By that I mean they will stand with you, see how far you can lean forward, how far your reaching capabilities are. We don't necessarily think of it as often, but our balance is also based off of our ears. So if we do have something that is off, our therapist will help and identify and then teach you how to maneuver in the home with some of the issues that you may be experiencing. So we used to have a patient on care with us. She did suffer from schizophrenia. She actually had not showered in 2 years on her own. And our occupational therapist was able to come in and teach her how to balance herself and how to get in and out of the shower. And after about 4 months of working with our occupational
Melanie, how can home care back that up?
Well, and as I say, when I'm saying ours, agencies, they have certifications,
Okay.
and they're either gonna be home health aides with a certification, or they will be certified nursing assistants, which is a little higher level. And they all learn how to help people walk, what side to walk on, depending on where an injury might be. They learn to use a gait belt, so they belt that goes around a person to help them get both out of the chair or out of the bed and also walk. Because sometimes it's you can pop in, but it's the confidence factor that's hard for some of them. And then again, if we know in time that we're going to be caring for someone and they're coming out of rehab, we will go to the rehab with the caregiver and film the rehab so that we know how is this person supposed to transfer, because not everybody's the same, you know. And then of course we wouldn't post that anywhere, but we would share it with a second caregiver who maybe wasn't able to be there.
Is that something that you'd be able to share with a home health team that came in? So that would be beneficial for our team as well, seeing how you were walking when you were in the rehab or inside of the hospital and then transitioning home. Because again, in the hospital, you don't have your furniture, your bedside table, your coffee table. So with that video, it would be able to help transition our team to teach you how to use that device, how to safely move it, and if it's actually the correct height for you. Some walkers or canes are not the height that they need, and it causes you to slump over, and that's where our physical therapist would be able to make sure you have the right equipment.
The key is making sure people put off decisions. So the key is figuring out if you've got somebody at home that you're depending on caring for you, and in fact, you've been caring for them for a long time, they're probably not going to be able to care for you, and you're going to need help, so make the decision before you leave rehab so we can come and be part of that.
We have a couple right now in the community, and one of the spouses was just released from skilled nursing back home, and they've been married many years, and the other spouse is like, well, I'm gonna have to learn how to take care of them. And we talked through that, like, I think you're gonna need some help.
Yes. Because in your head, what you can do is different in reality. I mean, even if it's not like, oh, that's gross, I'm sorry, I'm not doing that. It's your baby, this is somebody you've lived with forever. But if the size difference is big, and you're not, if they don't have the core strength to help you, it's gonna be physically impossible, or it will harm you. And our folks are trained to do it.
Well, I know when we had help with my dad, it made a huge difference for my mom. Like, and she was amazed at how quickly they could get things done versus her trying to do some of the things, so,
I know we're known as like skilled and non-skilled.
non-skilled.
Yeah, and that's why I don't really use that
Yeah,
because
there's some skills
there's a lot of
involved.
skills involved. A lot of skills involved.
Let's jump back over to medication. We talked about what you're allowed to do and how that works. Let's say I get a new prescription. Do you guys pick things up for us? Is the medication locked? All of that stuff, because that does begin to be a heavy thing for people, a heavy lift, as they're trying to remember, did I take that pill, or when do I take that pill, and things like that. Paige?
So for our team, we are not allowed to pick up the medications on behalf of our patients. Our main role is making sure that you understand when to take it, how to take it. If it is in your home, we are able to assist with putting it away, taking it out. We have a specific cabinet for it. Our clinicians that come in can assist with that. But as far as picking it up, that's something that we're unable to do. But the main purpose of our team is to make sure that you understand what you're taking and why you are taking it. And then obviously obviously to teach you any signs and symptoms of medication withdrawal or even some effects that you might have. So this way we can be in contact with your provider if you need something that is a little bit different.
We can go pick it up.
Okay,
Absolutely.
all right,
Take you with us if you wanna go.
okay, even if I wanna sit in the car?
We can stop afterwards and go to lunch.
Okay, guaranteed?
Absolutely.
Okay.
And we can also, you know, go with you around Publix and pick up your groceries.
Okay.
That's one of the things we do. We're not a medical team, but our caregivers are trained to notice changes. So if we notice a change and it may have something to do with the medicine, our caregivers will call our nurse. We have a full-time nurse, and she'll call the nurse. They may take pictures of what's happening, so that Shana can interpret it better and decide, do we call the family, do we call 911? We may call the doctor, and we can call the doctor. Or you call your own health. If y'all are part of the story, absolutely. Yeah, the locked part, that's a family decision.
So like a pill,
Yeah.
machine.
Kim's mom used to have ones that his sister set up for her, and they're various types and expenses and such.
Can be helpful, it just depends on the person.
Yeah, but somebody's gonna need to fill it. And if there are care managers out there, we work with one care manager who, if you're gonna get a full-time care manager for a whole lot of things going on, they're very expensive. But they do this pill management for fairly cheap.
Okay.
And they would come in like once a month and set up a bunch of pill containers.
Okay.
They also have an option too, which we partner with in the community. They have pharmacies that can actually deliver the meds to your home, and they are pre-packaged to set up your morning, your afternoon, and your night medications. And it's a little box, and as you pull the box out, it'll have a date and a time on it, and that would be your first dose. You just rip open, pour on your hands, and take the medicine. So we do have partners in the community that have that ability to deliver those meds to the home for you already set up.
Would that be like an independent pharmacy or some of the chain pharmacies?
I believe it's both.
Okay.
I do believe it's both. So we have met some partners in the community doing events like this, but I do have that option and can connect you.
Okay.
It can be somebody that can come talk to you guys next time.
That would be awesome, thank you. Melanie, we touched briefly on the subject of dementia earlier. And that we know can run the gamut. You can have someone that's very docile and maybe non-communicative. You could also have somebody that's very aggressive and combative. How do you all deal with that?
Our first step is to make sure all our caregivers have dementia training. And our nurse that I mentioned, Shana, before, she had to write her own curriculum and have it certified and everything, but she's a certified dementia trainer under the Florida Department of Florida Consumer Affairs. No, Elder Affairs. I never get it right. Thank you for being here, Kim. And so we do training at least once a year, depending on how many new caregivers we have, so they are trained. And they have a certain number of types of certifications they have to work for us too.
Okay.
And dementia training is one of them. That's in here, that's like in the classroom. In person, we get to know the people and we get to know the caregivers. And there are certain caregivers that we know are very good with the aggressive folks. I mean, because almost anybody can handle the I'm very sweet and docile, I just don't remember my name today. And I might not remember which door I need to go to get to the bathroom or something like that. Those are very easy. It's the other ones that are hard, and sometimes one turns into the other. So like right now, we work with, I'm sorry, Robin isn't here, but we work with ADRC with their program their respite program, they've gotten a grant.
Is that the guide program?
No, it's
They're
different
different.
actually from
Okay.
that. They got a grant to give, to give 45 hours, is it still 45 hours?
But they're getting another 45, a lot of them are 30.
Yeah, for respite care, and we will come in and do the care. And it's
Awesome.
usually, it's in 4-hour chunks, it's like, however the people want it, however the families need it, like if you had to go to a wedding or something.
You could do it on a weekend, or you
Yes.
could do it 8 hours a week.
Right, and
Okay.
if it were like an overnight thing, we do overnights, we do 24/7, we do
Gotcha.
all of that. But like, there's this one lady we're working with through that program that I watched a video of her and her daughter and her son-in-law are some of our good friends. And it broke my heart to hear how this lady was talking to her daughter and about her granddaughter. And so they're like, this is not her. So we don't just trust anybody. We send our best.
Gotcha.
Are tried and true, because a lot of times it's just kind of smile and nod and offer kindness and
Redirect.
they redirect,
Yeah.
but sometimes we've had to give up on people because they kept hitting our caregivers. When they're trying to get them to the bathroom or something, and there's only so many times they're gonna get hit on the side of the head really hard. And that's, medication is out of whack, or medication can help that
Right,
anyway.
right.
So it's a matter of matching the people up well and having trained caregivers.
I like that. And ADRC, Alzheimer's Dementia Resource Council. Center. I always get that
I
wrong. Tremendous resource. So if you know of someone that is giving care to someone that has dementia or Alzheimer's, I highly recommend that you connect with them. They have a tremendous amount of resources, and in their new, recently renovated facility, they're doing some great classes. They have an amazing library. One of the things that I loved when I was at their grand reopening was they had a children's area. So a young person can learn about what's going on with grandma or grandpa or aunt or uncle. And I thought that was really, really nice. We really focused a lot of our discussion on living in the home, like the single family home. How does it work when you go to a community like Allegro or the Mayflower, one of our other partner communities? Is it just the same? Is it a little different?
So for us, it would be just the same as we would in your home, because that is how we view the assisted living or the independent living facility. It is still your home, we still have to be welcomed in by you, and we still need your permission. So we treat that the same as living in your own home, because that is what we call home. So our clinicians, our nurses, therapists, occupational therapists, they come in and they will perform the exercises that you need or the medication fill that you need within the comfort of your room or even in the hallway of the assisted living facility that you are in.
Melanie?
We're a little bit different because there are oftentimes rules that we need to follow. And so we have to ask ahead of time, what types of certifications do you need for us to prove that our caregivers have?
Okay.
When we went, we've had several people in the nursing home, the VA nursing home in Baldwin Park. And they have a pretty rigid set of rules you have to follow, and our caregivers have to go through an orientation. When we go to Westminster Towers, really all they need to make sure is that we've got an up-to-date TB test on our caregivers. But every community is a little different that way. And they also, you generally want us to know things like their emergency escape routes and stuff, all of the emergency plans, because we're gonna be with that person.
Sure. It's funny because as you're talking about that, our movers that we use have to be approved in the communities as well. so that they know which elevators they're supposed to use and how they're supposed to treat the public spaces and things like that. So I think it's great that, as you work within the communities, you're honoring, their domain, just as you would in someone's home. Paige, you touched on this a little bit. You said, you know, we treat it as your home. We have to have permission to come in. What do you do when the patient doesn't want home health coming in and I can handle it myself? How do you guys handle that?
So we will always honor patient's choice. It is your decision to have us, but part of what we do is to inform you about things that you may not be aware of or feel are important yet. So it is the clinician's responsibility to be able to identify any concerns or issues that you may have. So part of the reason that we initially come out to visit with you is because either your doctor or a hospital or rehab has given us an order to say, you know, a change has just occurred with this person and we need you to go in and assist them. So we have had some patients in the past who refused home health, and after some education and, you know, just the reason why we're there to support you, some of those patients have changed their mind and have had some success stories with being independent on their own, in their own homes or in their assisted or independent living. And then there are some patients, which we all know, who don't want it. They want to be left alone, and because we are an agency that honors by patient's choice, we make sure we provide them with that education. We do leave our information if they change their mind in the future, but we do not come back with that simply that they wish.
So that's something to talk to your all-star team about, right? I want, I don't want. Because if you don't want, you need to figure out why you don't want, right? And understand why it's needed in certain cases. Melanie, do you have anything to add to that?
I would say one thing I know we talked about earlier, is that hospitals and rehabs will have their people, their services, both home health and home care, that they want to recommend. But it is not their choice, it is yours. And even though the hospital's saying, this is the home health we send, this one's it, or this is the skilled nursing facility rehab we always send to. They're not you. You get to choose who you want to go to. And that's why we're, we try to be one of the choices. They should be giving people 3 choices. That's what a lot of these folks say they're gonna do, but then from the reality, and they only get one, and they think that's the only one they can choose. Especially if there's somebody who, like my mother, doctors were God.
Right.
You know, all authority figure, and so if the doctor told me that's the one I'm gonna use, then that's what I'm gonna use. My generation is more like, I may change the doctor.
Right. Right. So, let's talk about, making sure we have a good fit. Because to your point, if the hospital said, oh, try this, this is the one we send you, or this is the home health agency that we recommend, then maybe you take that, and it's not a good fit. What red flags are you looking for?
I would want to act before some of the red flags come up. You know, like in is it still up there now? But on this, it talks about, and you know, I wrote most of this just from being out there for several years now. But a W-2 agency, you want to make sure you have a W-2 agency for your home care. You just do.
Why is that important?
Because we as in W-2 agencies, we only hire employees, W-2 employees. Nurse registries who will never come out and just say, hey, we're a nurse registry. They won't. They are scheduling companies. They hire 1099 workers. So they are not allowed to train them. They're not allowed to supervise them. We do both. If our caregiver, which, you know, sometimes we have caregivers go in, like this lady who didn't like to go down to eat. with folks. I was there, I introduced a beautifully competent young woman, and she was all excited about this other lady teaching her to knit, and she was just bubbly and lovely. But our client was 95, and she just wasn't feeling it. So a week later, we sent our 57-year-old woman out, and they hit it off, and she stayed with her until the day she died. So they're just the red flags would be
So those
if
are-
someone's on their phone constantly.
Yeah.
You know, no. And or if they're not doing the basic cleaning they're supposed to do, like cleaning the dishes after they make their lunch, or cleaning up the bathroom, or throwing stuff they shouldn't where it's not supposed to be.
Yeah.
You know, that kind of things. But a lot of times it's just personality.
And it's okay to say something
Absolutely.
if it's not.
Not the first day. It's, you gotta give them 3 or 4 days, you know, because you're new, they're new, you gotta figure it out a little bit.
Let's talk a little bit about cost, because that's a factor that's always sitting, I think, in the back of our minds. Paige, home health, what does home health and cost, and is there a minimum amount of time that I have to commit to?
So there is not, home health is based off of the amount of visits that you have, but we are fully covered by your insurance provider. So as long as the home health agency of your choice is contracted with the payer that you have, so I'll use Medicare for example, so we are a Medicare certified home health agency. So if you have traditional Medicare, you call Elevate, you say, I need some help at home, we send the clinicians out, and it is fully covered by Medicare for you. So we do not bill our patients for any services that we render, even if, let's say you have an insurance change and we've come out and we've seen you for a visit. The home health agency cannot charge you. We do have options if you don't have insurance. Somebody can pay for the services on your behalf as well. And then some home health agencies do the option of what we call self-pay. So if you didn't have insurance or you didn't have an insurance carrier that you needed to utilize, you could call that agency. Each one is different, but typically the home health without the insurance ranges from $200 to $300 per visit.
Okay. Melanie?
Okay, and mine's way more complicated.
Well, give us a 30,000 foot view, if you will.
Absolutely. Absolutely.
Yeah.
Medicare covers a little bit of home care now. It covers through the GUIDE program.
Okay.
And in July 1st, it goes up to 76 hours of respite care. So that is for someone who is caring for someone with a diagnosis of dementia. And it's 76 hours for the year. So it's not a lot. And we are not a Medicare certified agency. So we work with Medicare certified agencies. So like Flourish in Place works with Advent Health and with My Memory Clinic and with Pocket RN. They are our Medicare providers, and we work with them. We provide the home care. We take long-term care insurance. So we've had discussions about long-term care insurance in here. And sometimes they don't like to pay you. So that's when I call on my attorney to help them understand their policies. And I really do get to talk to an attorney every day. For free. My whole life, my father was an attorney also. So those are the two. We are now part of something called Helper Bees, which is, you can go on and find through Helper Bees different agencies, and we are recommended by them, and they use Medicare Advantage. So like right now, we've gotten several with Humana. Mostly we are private pay. And most W-2 agencies are gonna be more expensive than a nurse registry because we pay all the payroll taxes. We have $3 million in liability insurance, you know, and so forth. So mostly it's private pay in 4-hour chunks. So we do 4-hour shifts. We are trying to keep our caregivers fully engaged so that they don't leave us because they'll go elsewhere, and we want to make sure we have a good one. So 4 hours, we try to do a minimum of 20 hours per week. And our rates right now, we go up every now and then. Right now, we're very middle of the road Orlando at $35 per hour. It's not cheap, and you deserve good care.
Right. Well, and that's why you work hard, and you save money, and you have somebody manage it for you, and, so that you can pay for those things when you need them, because we're all living longer, and chances are we're gonna need that.
And Rhett, I think, can talk to you about reverse mortgages,
Yeah.
which is another way people pay for their home care.
Yeah, 100%. That's another topic for another seminar, but one that my mind has been changed
Mine too.
about,
Yeah.
you know, I think reverse mortgage works for a lot of people to help provide the financing that they need. All right. We are gonna have a couple of Q&A time right now. I'm sure some of you probably have some questions. Do we have partners that have a microphone? Got one in the back row and one in the front row right now.
Which one do you want to use first?
Right here. And then Linda, maybe you come up here and you can grab Carl in just a second. Frank?
Are you on?
Yeah, good.
Oh, okay. This is a very broad general question. Is there a generalized percentage of time that's maybe speculated upon or known generalized, what's the percentage of people that take advantage of the home care vis-a-vis the number of people that take advantage of the Allegros and so forth? In other words, does 20% take advantage of your services and the other 80% like to go ahead and go elsewhere for it?
So-
There may be no figures on that. That's just a thought.
So if I understand your question correctly, like how many people are staying in their homes with home health care and how many people are moving to communities with
Yes.
maybe home health care
Yes.
or home care? I don't know if we have any statistics on
Yeah.
communities.
I don't have any statistics on that. I will mention though that, you know, that 4-hour shift thing, if we're in a community and like Brittany was saying, if it's scheduled, we can't do much except scheduling, you know, because we've got people who need shift work. But if we are able to get 4 or 5 people in a community that we can care for, then we can do very short shifts for each of them, as long as we can keep the caregiver in there for a while.
Gotcha.
But I don't know, that's interesting thought, I haven't gotten any statistics on that.
And I have to say, it's probably the decision of you and your family. Us, like, we currently have a patient that we're taking care of who lives up in Volusia County. And the daughter is the sole caretaker for her dad, and they came to the decision to move him to an assisted living. And our team was able to help with that transition. So we do see it often where they do transition from home to assisted or independent living facility. But I would say majority of the time they're usually already established in a place that they want to call home before they call on home health or home care.
Okay, great. I think Carl had a question.
You got a home?
Yeah.
Okay.
Full service.
How do you expect people to pay $6,500 a month for assisted living without long-term care? I am in an assisted living facility.
I know.
I'm lucky enough to have my insurance. But the average person, can they afford $6,500 a month for assisted living? How do they get the money to do that? Where is it coming from?
I'm assuming that's to me.
Well, and
And
I
I've seen you in your, in where you live, I saw your picture on the wall.
It's called Cascade
I know it's Cascade
Heights,
Heights.
you know where I am.
Yes, I do know where you are.
so that's,
what it costs for me at assisted living.
Yeah.
Now, it took 3 months in order to get my long-term care to okay that amount. It was like finding insurance companies. They like their premiums, but they don't like.
okay,
the
so,
So how does somebody get help?
Well, I'm just gonna give you one way, because, you know, because families oftentimes pay for people, there are different ways people pay for assisted living. But if you really don't, if you have a very low income, for one thing, if you're a veteran, the aid and attendance pension can pay for assisted living. The aid and attendance pension can also pay for home care. And we do that. That's how we started our business. So Kim knows all about that. The other thing is, and I go to these things all the time, and I speak from experience because my sister had to go through all of this, is a lot of times you just have to get Medicaid. And then you're not gonna have the beautiful facilities, but you are gonna have help.
right.
And there are a lot of people in town, and I know a bunch of them, who can help people get Medicaid.
And, oh, that would be Linda Solashri.
And many others as well, yes.
Well, you're our favorite.
Oh.
Yeah, so if that is a concern, obviously, my first thought was, I'm talking to the people that are in the back, my financial advisors, whomever your financial advisors are, to put that plan together. That's why you're here in the room now. Can you afford to live another 20 years, right?
Another option that you have too, some home health agencies in the community have a medical social worker. So we as Elevate, we do specifically have a medical social worker that can come to the home, and they do offer community resources. Some of them have a wait list, but they can provide you with some resources that might help offload that cost or set you up with Medicaid, or even talk to, you know, partners in the community that can assist you in getting those taken care of.
So it's part of putting that plan together so that you're not in the position of, oh my goodness, this is what I need, and I can't afford it, right? So that's why you're here. If you don't have a plan, you're in trouble. Yeah, yeah. Any other questions? Let's get you the microphone.
I have two questions. What were the initials and what do they stand for? The company or the agency that's going to pay for extra $45. I know somebody that really needs.
45 hours, it's Alzheimer's Dementia Resource Center.
ADRC, Robin, who's normally here,
Her card is probably in your folder. My card, I just realized wasn't in some of the folders, but I have a bunch of them outside.
ADRC, Alzheimer's Dementia Resource Center.
Somebody mentioned the VA nursing home has, we send off the part, it has something to help.
So there's skilled nursing at the VA in Baldwin Park, and then there is the VA aid and attendance program.
Right, and there's also the VACCN,
What's CCN?
which stands for,
Community Care Network.
thank you, the
Community.
VA Community Care Network. So if you're not the aid and attendance pension has a lot of requirements. And that's another time.
Yeah.
But the VACCN is for all vets, and you just have to register with a vet, you have to have a veteran a VA doctor, right? And then the doctor can recommend hours for you for home care. And we work with them, we get those folks all the time. Sometimes the hours are not very many, it's awful, they don't get what they need. Sometimes it's just like 12 hours a week, or.
But it's better than nothing.
It is.
Right. Any other questions? Over here, Elaine.
Other Elaine. You mentioned in the home care side, a CAP specialist.
CAPS specialist.
Okay, is that the secret? What does that mean?
Certified Aging in Place Specialist.
Thank you.
CAPS. And it's kind of weird because it's a CAPS specialist, but it's Certified Aging in Place Specialist. Kind of the two terms that we use. I have run across, obviously we had one here on our panel a couple of years ago. She was a physical therapist. I have met general contractors that are Certified Aging in Place Specialists. So it's coming at it from a different angle. I think the certification is the same, but then you've got this base of knowledge as well. And I think that's where, again, it's putting that team together when you know you have a need. For instance, I took pictures of my parents' bathroom and sent them to the CAP specialist because there was not a CAP specialist where they lived, and let her look at the bathroom and tell me what needed to be put in there. I think by utilizing the physical therapist, the occupational therapist that you may have access to with home health, then getting plugged into the person that's going to know the right equipment and how to install it properly is the big part about that, having that CAP specialist. Sure. Anyone else? All right. Well, with that, we're gonna wrap things up. Did we try and sell you anything?
No.
Did we give you something to think about?
Yes.
A few things, right? So what are you gonna do with the information that you gleaned today? We challenge each of you to have an action step, even if it's one thing that you need to think about a little bit more, or maybe discuss with someone on your all-star team. You are our connection to the world. I'm grateful for those of you that brought a guest today. That's how we grow our community here. We also grow and do better with your feedback. And so we need your blue sheets. Don't walk out of here without them. You can give them to Nicole or me or one of our educational partners. Let us know if you want to come to the next seminar. And if there's anything you need, you can indicate it on that blue sheet. And our next, as I mentioned earlier, next seminar, we're going to be tackling the topic of life documents. What are they? How long to keep? When to trash? We're going to talk about some other legal ramifications. So bring all of your, I always wanted to ask a lawyer this, questions, and we'll be able to get that done. Our closing quote is from Marcus Aurelius, one of my favorites. I love the Stoics. We are all here with each other because we need each other. Those who help and those who are helped. Thank you for coming and being a part of this community. It's a privilege to do life with each and every one of you, and we will see you next month.